Hi, my name is Heather Hitchcock, and I'm the Community Education Manager for Bristol Behavioral Health. I'd like to speak with you today about suicide prevention and the warning signs and things you can do if you think that someone is suicidal. There are many risk factors and warning signs associated with suicide. Someone might have a negative self-image, they might be isolated or feeling alone. They might be showing signs of aggressiveness and irritability that aren't normal. They might be feeling like a burden to others, talking about being a burden to others. You may be noticing drastic changes in their mood or their behavior. You might see self-harm behaviors like cutting or burning themselves. You may see them giving things away, kind of doing an end-of-life cleansing. They may be actually making suicidal threats. All of these need to be paid attention to. Warning signs related to talking, behavior, or moods can be broken down. Talking. So maybe someone is saying, I'm thinking about killing myself. That's pretty obvious, but even in a roundabout way, talking about killing themselves. If they're talking about feeling hopeless, if they vocalize that they have no reason to live, or they feel they have no reason to live, if they vocalize that they feel they're a burden to others, if they're feeling trapped, or if they're experiencing unbearable pain. Sometimes it's not what they say, it's how they behave. So behaviors may signal a risk as well, especially if they're related to a painful event, loss, or change, like we mentioned. You might see an increased use of drug or alcohol. They may be looking for a way to end their life, such as searching online. This is especially true with teens. Withdrawing from activities they normally take joy in. If they start isolating themselves from friends or family, unfortunately, again, with COVID, it's hard to know these things because we're all isolating more. If they're sleeping too much or they're sleeping too little. If they start visiting people, calling people, FaceTiming people to say goodbye. If they're giving away their prized possessions, or if they're showing increased signs of aggression. Those are all behavioral changes that can be a signal. Maybe you don't see a difference in their speaking or in their behavior, but you notice a difference in their mood. People who are considering suicide often display one or more of the following moods: depression, anxiety, those two keep coming up, loss of interest, irritability, humiliation or shame, anger, agitation, or all of a sudden showing relief, a sudden improvement. Believe it or not, that can be a warning sign as well. So let's talk just a little bit about teens. Additional warning signs to consider in teens can be a change in their eating habits, in addition to the change we previously mentioned in social habits, in sleeping habits. If they're withdrawing from friends, from their family, or from their regular activities. If you're seeing violent or rebellious behavior, kids running away, drug or alcohol use, unusual neglect of their personal appearance. If they normally take great care in how they look and they suddenly stop doing that, why? If you get frequent somatic complaints, those are usually related to emotions, stomach ache, headache, fatigue. Or if they're not tolerating praise or rewards well. We can also talk about warning signs in older adults. Again, the same warning signs from previously apply, but sometimes there's a little bit of difference in a senior person. They start reading things about death and suicide. Again, sleep comes up, disruption of their sleep patterns. Again, drug and alcohol use increase comes up. If they fail to care for themselves or they stop following medical orders, maybe someone's been taking a blood pressure medication for years, and all of a sudden they stop taking it, just saying, I don't need it anymore. If they start stockpiling medications or take a sudden interest in firearms, or if you see social withdrawal, elaborate goodbyes, or a rush to complete or revise a will. Warning signs with our seniors. Suicide risk factors can be broken down into kind of different categories. We can have mental health factors that increase the chance of suicide. We can have environmental factors. We can have historical factors. So I'd like to run through those real quick with you. Mental health factors can, again, increase. Mental health factors can include, there's that depression again, substance use problems. Substance use problems, when combined with depression or bipolar disorder or any mental health condition, can increase suicide risk. Having bipolar disorder, having schizophrenia, someone who has personality traits of aggression or mood changes, who has poor relationship skills, a conduct disorder, an anxiety disorder. If someone has a serious physical health condition that includes chronic pain, that can increase their risks of suicide. Chronic pain is terrible to live with. If someone has a traumatic brain injury, and this is interesting, the CDC studies find that the prevalence of suicide among people with epilepsy compared to the population overall was 22% higher. So environmental factors, well, what environmental factors could affect suicide risk? Access to lethal means, such as firearms or drugs, a prolonged stress, and often, unfortunately, we see this in teens or younger children, ongoing harassment, bullying. It can happen in all age groups, though. Relationship problems, unemployment, again, a COVID stressor. Stressful life events such as rejection, divorce, a financial crisis, any life transition or loss. Again, COVID impacts this. Exposure to another person's suicide or to a graphic or sensationalized account of suicide can increase the risk. Historical factors, that's kind of an odd thing to think is a risk. However, a previous suicide attempt increases someone's risk. A family history of suicide, or childhood abuse, neglect, or trauma will increase the risk for suicide. I'd like to take a minute to talk about a few statistics associated with suicide. Unfortunately, there's a huge stigma that surrounds suicide, and that leads to underreporting of suicide. And the data collection methods are critical to suicide prevention, and we need to improve our reporting and our data collection. We do know suicide is the 10th leading cause of death in the US. Each year, somewhere around 47,000 Americans die by suicide. And suicide costs the United States $69 billion annually. Now, if you're like me, you'd say, how does suicide cost the US money? Well, medical costs, individual and family expense for loss of income to the family, a loss of productivity for employers. The list is fairly long. Men die by suicide almost 4 times more than women. On average, there are 132 about 132 suicides per day. White males account for over 69% of the suicides in 2018, which is our most recent statistics. Firearms account for 51% of all US suicides in 2018. The rate of suicide is highest in middle-aged white men in particular. So between 2000 and 2018, there was a significant increase in the overall US suicide rate. And that particular study didn't attribute that to anything specific. A few more. Suicide attempts. Based on a 2017 Youth Risk Behavior Survey, 7.5% of youth in grades 9 through 12, so that's your high schoolers, reported that they had made at least one suicide attempt in the 12 months prior to the study. Girls attempted suicide twice as often as boys. Approximately 2.5% reported making a suicide attempt that required some kind of medical treatment. When it comes to suicide and suicide attempts, there are rate differences depending on demographic characteristics, such as age, gender, ethnicity, and race. That being said, suicide occurs in all demographic groups. So I've mentioned that COVID is exacerbating these things a little. There aren't a whole lot of studies so far since COVID has only been around, well, gosh, almost a year now. But in June, there was a study done, and 40% of US adults reported struggling with mental health or substance abuse. We just want you to know it's okay to ask for help, COVID-related or not. The National Suicide Prevention Lifeline is a 1-800 number and can be called 24 hours a day, 7 days a week. So you might be saying, Heather, what do I do if I think someone is at risk for suicide? Take that person seriously. Stay with that person. Absolutely help remove all lethal means from their environment. Get rid of any medications, get rid of any firearms in the home or wherever they are. Please call the National Suicide Prevention Lifeline with them. Don't just let them say, yeah, I'm gonna call, I need some privacy. I'm gonna dial the phone for you. Now, there's even a text suicide crisis line. So if someone is more comfortable texting than actually talking, they can text the word talk, T-A-L-K, to 741-741. And they'll get a text back from a trained crisis counselor, 24 hours a day, 7 days a week. Or just escort them to a mental health service or to an emergency room. Just take them. What can you say? What can you say to someone? Well, you know what? Just be yourself. Ask, are you okay? I've been worried about you lately. You haven't seemed yourself. I've noticed some differences in you, and I'm concerned. It seems like you're going through a really difficult time. How can I help you to find help? Not really, how can I help you? Because we're not trained professionals. We can't really help if someone is suicidal, but we can help them find someone who can help. I'm worried about you. Can we talk about what you're going through? If you're not comfortable talking to me, who are you comfortable talking to? You may not be the person that person is willing to confide in. That's okay. Help them find someone who is. But you may know that person better than anyone. Say what you think is going to get that individual to talk. Then you've confirmed that they're going through something, that they're having a difficult time. Go ahead and say, are you thinking about suicide? Do you have a plan? Do you know how you would do it? When's the last time you thought about suicide? If the answer to any of these questions is yes, or even if the answer is no, and you do think they might be a risk of suicide, you need to get them help immediately. If they're already working with a therapist or a psychiatrist or any healthcare professional, go ahead and call that person if they're available. Remove any potential means, again, get those weapons and that medication out of the house to reduce the risk. Call the National Suicide Prevention Line, or please just bring them to their nearest ER. For example, Bristol Hospital has a crisis center right in the ER, and there's someone there from 7 a.m. until midnight every day who is trained specifically to deal with mental health crises like that. Listen to the person, express concern, reassure them that it's okay to be having this conversation, that it's okay to be feeling this way. Remember, a suicide threat or an attempt is a medical emergency. It requires a professional as soon as possible. This isn't something that we can sit on. This isn't something you can sleep on and wait till morning. It's very important that you focus on being understanding, caring, and non-judgmental. Say things like, "You're not alone. I'm here for you. I'm going to help you get through this. I'm concerned about you. I want you to know there's help available. I may not understand exactly how you feel, but I care about you. I love you, and I want to get you help. You're important to me. We're going to get through this." Whatever comes to your mind to show that you care about this person and that you will stay with them while this problem is fixed. Suicide in America is a real problem, and it's not a problem to be ashamed of or to hide. If you or anyone that you know is considering suicide, please take some action. Get them to a local ER, get them to a crisis center. Call the suicide prevention line or text. Any of the above will absolutely help save someone's life. Should you have further questions, feel free to call Bristol Health at 860-585-3000.